RIP Frank MD friends, we are here with this lovely young woman who thinks she looks messed up. She's not really messed up, but I want to talk briefly about injectable complications, medical, but in this case, aesthetic. We got a phone call from her. She had some treatment, some injectables, neurotoxin, neuromodulator, and some filler about a week ago. She doesn't like the way it's turned out. She was very surprised about the filler around the eye, the bruising around the eye, which is very common with any neuromodulator. And then she had some filler in the chin and the feeling that her smile and face is now asymmetric. Now she had no filler placed anywhere else other than the chin. We don't like it because it's lumpy, bumpy. She feels it when she washes her face. I'm not sure what product it is. What product you use in the injection technique is what's going to define how it looks. But either way, it doesn't fit her face. In terms of the asymmetry of her face, this side is a little lower than that. Most patients think that this is due to filler, but she didn't have filler placed there. And what you have to realize is that neuromodulators placed on the upper face can actually affect the smile because the orbicularis oculi muscle here is connected to one of the zygomatic muscles that go to the corner of the mouth. So if you come too low and you try too hard to get the little creases, which by the way, she probably never had to begin with, okay? It affected her smile and the symmetry of her face. Now this is, fortunately, she has a very mild case. Some people, literally, their smile crooked or their cheeks will puff up, they'll think it's filler, but it's actually from injecting the lower area of the orbicularis oculi. Interestingly enough, she had Daxxify, which is one of the newer neuromodulators that is supposed to have greater potency and longevity. This is a patient who probably does not need something that potent or long-lasting. She would do well at her young age with any of the other neuromodulators, Xeomin, Dysport, Juvo, and again, being very conservative on this lower injection is most important. And for your older patients, you have to make sure you tell them you can't get too crazy about those lines. So the good news is, I told her, this will wear off in about a week or two, that weird feeling she has. I don't think she needs any injectables to balance it, and you really have to wait for that to go down. In terms of the little bruise, I'm going to take my vascular laser, which, by the way, if you're getting injectables, do not have someone inject you with anything unless they have a vascular laser to reverse the bruising. Again, with any of these things, it's easy to be a great doctor when everything goes right. It's most important to be a great doctor when things go wrong, whether it's something very mild and aesthetic like this or something severe and emergent like a vascular occlusion. About 15% of my patients are corrective patients. Once a week, I do get referred patients for more emergent stuff. Fortunately, this is very mild. She thinks she looks worse than she does. I am going to use a small amount of hyaluronidase. I'm going to assume this is hyaluronic acid in the chin. It's going to go away in 24 hours. The bruise will go away in 24 hours, and she should be great. And then patients are always like, well, doc, when can I get back in the game again? And I usually would give it about a week for everything to settle, and then we could decide if we need anything else. My feeling is you're really not. I want to see you go back to normal, and that's it. So again, minor complications, aesthetic ones along the spectrum. Make sure you go to someone who knows how to handle the bad as well as the good. We're going to get to this. Here we go. I'm going to zap. I can't get right on your eyelid, but no one can see that anyway.
You're gonna zap.
I'm going to zap right up there.
Okay.
And I want her to get one of the elastin products
All right.
that helps metabolize. There are some newer medications, not just arnica, that help that yellow-green go away.